Part 3 of this DVD gave you some basic information about pain management, but we promise to discuss the subject in more detail here in the special features section of our DVD. Nobody likes pain, but the thing to remember is that it can be controlled through medication and other means. You should be able to move around, sleep, and take deep breaths without severe pain. Medications are probably the single biggest component of your pain management strategy. In a moment, we'll go over the different kinds of medications you'll encounter. But before we start, I want to emphasize the importance of using your medications before your pain becomes hard to tolerate. Your surgeon will likely prescribe pain relievers to be taken every few hours, as required. That means that you can choose to delay a dose if your pain is tolerable. But if your pain is bothersome, take your next scheduled dose of pain reliever. It can become very difficult to manage pain that has been allowed to get out of control. As the days go by, you'll naturally take fewer and fewer doses of pain reliever. This will allow you to naturally decrease your dependence on opioids and avoid withdrawal symptoms that arise from abruptly stopping this sort of medication. Patients are sometimes concerned about the habit-forming potential of these strong pain relievers. But used in the right setting and in the right way, these problems are rare.
Addictions to medications taken for a painful condition are rare. Physical dependence, which is different from addiction, happens when your body adapts to certain pain medication over time. Nausea, vomiting, muscle cramps, and sweating can occur if certain pain medications are stopped suddenly. To avoid these symptoms, prescription pain medication should be discontinued slowly.
So what kinds of medications might your doctor prescribe after surgery? Let's take a look.
Acetaminophen, sometimes known as Tylenol, is often used to treat mild to moderate pain. It can be purchased without a prescription and should be used as directed on the product's packaging. Do not take more than the maximum daily dose. And if you suffer from liver or kidney disease, talk to your doctor before using this medication. Non-steroidal anti-inflammatory drugs, also called Nsaids for short, are like aspirin and can be used safely with acetaminophen. Nsaids can be purchased without a prescription and should be used as directed on the product's packaging. Do not take more than the maximum daily dose. When used together, Nsaids and acetaminophen can be even more effective at relieving pain than either one on its own. And stopping Nsaids or acetaminophen abruptly will not cause withdrawal symptoms. While Nsaids are generally safe, they're not suitable for everyone. Nsaids may not be recommended for patients with heart disease, high blood pressure, asthma, kidney disease, or a history of gastrointestinal bleeding. Nsaids may affect your body's ability to clot. For this reason, your doctor may not want you to take an Nsaid following surgery. Celebrex and new similar drugs of the same class are a type of Nsaid that won't affect the body's ability to clot as much and may be less irritating to your stomach.
Consult your physician to determine the medication and dosing that's right for you. If you experience blood in your stool or blackened stool, stop taking the NSAID medication and notify your surgeon immediately.
While acetaminophen and Nsaids are important, the morphine-like drugs known as opioids are the most widely used pain relievers for moderate to severe post-operative pain. Opioid medications include drugs like codeine, oxycodone, and hydromorphone. Long-lasting formulas can provide relief for up to 12 hours. Early on, after your operation, opioid medications are often necessary to properly control your pain. Remember, pain control is important for healing, so if you need them, take your pain medications as prescribed by your doctor. Drowsiness and nausea are common when you first start taking opioids. Do not drive or do physical activities that require good balance or concentration while taking opioid medications. Constipation is common when taking opioids. Always drink plenty of fluids and eat a high-fiber diet that includes bran and fruit when taking opioids. You may also use fiber supplements like Fruit Lax or Get Up and Go cookies. Recommended laxatives for more troublesome constipation include lactulose, glycinid, Senecot tablets, or Senna tea. These should only be used temporarily. Alcohol consumption or sedatives such as sleeping pills unless prescribed by your surgeon, should be strictly avoided while taking opioids.
Of course, some procedures are more painful than others. If your pain is expected to be more difficult to manage, your surgeon may want you to remain in the hospital after your operation. In those cases, your anesthesiologist can offer you some very effective pain-relieving therapies. Those include
an epidural. A small tube is inserted into your back to provide you with continuous pain relief for up to several days. Or you might be prescribed an intravenous opioid, something called PCA. This is also an effective tool for the first few days following surgery. In some cases, your anesthesiologist may inject or insert a small tube along a specific nerve to keep the skin over your incision frozen for several days after your surgery. This technique is known as a nerve block.
These methods offer superior relief after painful operations. If any of these measures are likely, your anesthesiologist will discuss this with you when you visit your hospital's pre-admission or optimization clinic. While these are very effective pain relief techniques, they are not suitable for everyone and can only be used while you are in the hospital and under the supervision of your anesthesiologist. Some simple techniques can actually add to and improve the effectiveness of your medications. Here are a few.
Relaxation and distraction are two natural techniques that may help reduce pain. To relax, try deep breathing exercises where you inhale and exhale very slowly. You can use distraction by trying an interesting activity where periods of focus and concentration are needed. Inflammation is a common cause of pain, and cold compresses can help reduce inflammation. Cold packs can be made from a bag of frozen vegetables or ice, wrapped in a towel and applied to the painful area for no longer than 15 minutes.
If you have a history of poor circulation, do not use cold packs. Before using cold compresses, please discuss with your doctor first. Do not use heat for post-surgical pain. Pain from surgery may actually worsen if you apply heat.
For certain surgeries, particularly orthopedic procedures, physiotherapy is an important part of the recovery and pain management strategy. Your surgeon will discuss if physiotherapy will be part of your treatment.
This concludes our special feature on pain management. We hope it's helped clarify what to expect and to reassure that any pain you experience after surgery can be safely managed. Thanks for watching.